In general, men aged 55 to 70 should be screened for prostate cancer, and that's a general rule. There are exceptions to that. If you have a family history of prostate cancer, if you're African American, or cancer of other types run in your family pretty heavily, then you can be screened starting at age 40 to 55, but really you have to have risk factors to undergo that. And then beyond 70, we're living longer, and so a lot of when we decide to stop screening men for prostate cancer depends a lot on their overall health. So just because you turn 70, that doesn't mean we stop. If you're really healthy and you're active, we oftentimes will screen up to 75 or 80. A typical screening appointment with urology usually takes about 15 to 20 minutes. And the two main components of a screening exam include PSA value, which is a blood draw test, and a digital rectal exam. And the PSA value really just helps us identify patients that are at higher risk. So a higher PSA means you are more likely to have prostate cancer. And the rectal exam allows us to kind of feel the prostate and see if there's any abnormal growths. So we combine those two things to decide what the next step should be in screening. An elevated PSA again kind of tells us that maybe we should look closer at the prostate and rule out some of the more dangerous things. Prostate cancer can elevate PSA, but also inflammatory conditions and infections, those can elevate your PSA as well. And so we really want to make sure and rule out the really scary things. And so if we believe that the PSA elevation is related to potentially cancer, the next step would probably be either a prostate biopsy, where we look at the tissue under a microscope, or oftentimes we'll pair that with an MRI. And more recently, MRIs have been really beneficial because they allow us to be more accurate with our biopsy. So we can look really closely at the prostate and say there's a dangerous area over here. Let's make sure that we biopsy that specific area. And so that would be the next step. With a good screening program, oftentimes men with prostate cancer have no symptoms. But because the prostate is intimately involved with the urinary system, oftentimes urinary symptoms are what we see. So urgency and frequency with urination, or difficult with emptying their bladder. And then men that have more advanced disease, where it's maybe spread, you would see more classic signs of like a cancer. So weight loss and poor appetite and kind of bony pain. The majority of men that I see that end up getting diagnosed with prostate cancer don't have significant symptoms that they're able to identify. Now, the prostate can grow and cause symptoms with urination and not be prostate cancer, so it's sometimes difficult to distinguish between just benign enlargement of the prostate versus true prostate cancer. A good screening test is cheap and readily available and identifies problems that change a person's life. And so prostate cancer is really common in men, and the goal of screening is always to catch something when it's treatable. And once prostate cancer spreads beyond the prostate, then it transitions more into a chronic disease, something that we take medications for lifelong, and less something that we can treat for a cure. And so identifying patients that have prostate cancer only in their prostate can be really beneficial for them, so that they don't have to take those medications and have the side effects associated with that throughout their whole life. General recommendations for a healthy lifestyle are something I always recommend to patients. So, if they're smoking, to stop smoking, maintaining a healthy body weight, getting plenty of exercise, and then eating a healthy diet. All of those things maybe have not been shown directly, but are, just overall make you a healthier individual, and what I generally tell folks.